to implement measures that are much more stringent. We'll see more of these travel bans, more quarantining of residents returning home and not allowing non-residents to come in. And it's also concerning that this was a 44-year-old healthy man. I mean, I think we'll learn a little bit more about him in the next couple of days, but it wasn't someone in his 70s. It wasn't an infant, and that is concerning.
Yeah, that's very alarming. Okay, going back to Latin America, Alistair alluded to this, just the infrastructure in some of these Latin American countries just aren't equipped. Mexico maybe is an exception, but you know, Venezuela, which is already dealing with a crisis there, how do they handle this if it does come to these countries, and what do we need to do outside of Latin America to help them?
Right. So Venezuela already has a measles outbreak. In fact, they've exported measles to several other countries in the region which hadn't had it for quite a while. You know, their health system is falling apart. A lot of health workers have left because they haven't been paid. There's a shortage of medicine. So it's very concerning if coronavirus gets in their system. And luckily, PAHO, the Pan American Health Organization, which is the regional arm of the WHO in the Americas, is quite robust and will be able to launch a very good response if coronavirus is found in Latin America.
And a lot of these places are very condensed, too, a lot of population centers.
Yes.
So, yeah. Well, the U.S. Centers for Disease Control and Prevention says the immediate risk from the virus here is low. Yet there are so many unknowns about this virus and this relatively long incubation period. Should we be concerned? What is the level of concern we really realistically need to have?
I think we should be concerned, and you know, people should take measures to keep themselves safe, which includes, you know, good hand hygiene, getting vaccinated against the flu if they haven't already, you know, not touching their face if they can avoid it. And you know, local communities will take measures such as making sure that every hospital is equipped to handle people with respiratory symptoms, to isolate them, to do the proper testing. And it's probably good for everyone to have a 30-day supply of medication at home, you know, ample stocks of food and water. You know, no matter whether it's a hurricane or a flu epidemic or coronavirus, a lot of what you can do is the same.
One positive I'm seeing is that scientists around the world are cooperating more, and that's not always the case in the scientific community. How do you think that will help in combating this coronavirus?
It will make all the difference. You know, within weeks, the Chinese scientists had sequenced the virus and actually published it. There's already rapid kits available, rapid testing kits. You know, people are sharing their supplies of protective equipment. You know, the Pasteur Institute has a plan to have a vaccine in the next 20 months. So I think this could be a game changer as far as cooperation.
As someone in this field, what do you find most alarming about this virus?
Just the rapid spread, that there are now more people that have coronavirus than had with SARS during the entire outbreak. That is very concerning. And I think it's because transportation has just improved so much. You know, 10 years ago with SARS, you know, there was only 1/4 of the number of travelers in China as now. And so we're a much more connected world.